As the economy begins to open and protests continue to rage across the country, there are concerns about the virus spreading. Here to answer your questions, as he is every Friday, is Dr. Robert Tiballi, an infectious disease expert with the Catholic Medical Association. And Dr. Tiballi, as you know, protests are continuing around the country. Our reporters have been on the ground with the protesters. They say there's no social distancing. Most aren't wearing masks. So should we be concerned about a surge in virus infections?
Well, of course we should be concerned. There's no telling how profound this mixing of people in such close quarters could impact on the rest of society. It's possible that a lot of these folks may have already had the coronavirus back in April or before and gotten over it, but we don't know what settings they're going to go back to when they finish their protests and who they could infect at their work site. We would expect that we would see an increase, an uptick in 2 to 4 weeks after these events have started.
Boy, and keeping with the protest, the CDC says chemicals used by police to control the crowds, like they've been using pepper spray, that they cause coughing, which could spread the virus. Your thoughts on that?
Well, any type of extreme, vocal type of exercise, either singing or coughing, certainly could spread the virus, but I don't think that spreading the virus is the first thing on the policemen's minds. It's really to kind of restore order and with good reason these days.
Right, but even think about that, the singing and the chanting, all of that's going on. But here's another concern that many people have as the economy begins to reopen. Many will be going back to their offices, and even if they practice social distancing, can the virus spread through vents in office buildings?
Well, I don't want to disrupt you feeling good about things, but it probably can. In the building I'm in, which is 65,000 square feet and 14 different doctors' offices, we have a common duct air supply that recirculates air throughout the building. So technically, somebody could be coughing in my area and be exposed to those particulate matter in another area of the building through our vent. But if you have ultraviolet inside the vents, that should help inactivate the virus, but not a lot of buildings have that. But some buildings have HEPA filters on their supplier return, but many don't because the HEPA makes the fan so much more inefficient because of the high filtering capability. But your question, yes.
Wow.
You could get exposed throughout the building from common air.
All right, many will also be getting back on the subways. The MTA here in New York City has said it may be hard to social distance yourself from other commuters. So everyone's being asked to wear masks. Do you have any other advice for commuters?
You should wear gloves as well. They could be, some type of glove, either a workman's glove or a leather glove, but you don't want to have your hands in contact with surfaces, and keep the gloves away from your face. Don't do what I just did here. But, it's thought that the subways were actually one of the major vectors of disease dissemination throughout New York City, and one of the reasons why so many people got sick in New York. And so I think a lot of people are going to stay away from the subways with good reason until it's really quite evident that the coronavirus has subsided substantially.
All right, Dr. Robert Tiballi, thanks for joining us this week, and we'll see you next week.
Thank you very much. Take care.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and then click on the bell to get instant updates about all of our newest content, because we are putting your faith in the news.